When can I return to work after abdominoplasty surgery? Have you recently undergone abdominoplasty, also known as a tummy tuck, and are wondering when you can get back to work? The timeline for returning to work can vary based on the type of job you have and how extensive your surgery was. Generally, it is advisable to plan for at least 2 weeks off from work after the procedure. This time is crucial for healing, managing pain, and reducing swelling and bruising. If you have a desk job or a sedentary position, you might be able to return to light work activities around 3 to 4 weeks after surgery. During this time, you should notice improved mobility and less swelling. However, it is important to continue avoiding heavy lifting, strenuous exercise, and any activities that could put strain on your abdominal muscles. For those with more physically demanding jobs, the recovery period may take longer. You might need 4 to 6 weeks or even more to ensure that your abdominal muscles and surgical sites have healed sufficiently. Full recovery, which includes the resolution of swelling and maturation of scars, can take 6 months to a year. However, this does not mean you cannot return to work earlier if your job is not physically demanding. Here are some key points to keep in mind as you consider returning to work after abdominoplasty. In the first 1 to 2 weeks, focus on rest, pain management, and wound care. You may have drained tubes that will typically be removed during this phase. Between weeks 3 and 4, you can gradually increase your mobility and start light activities, with many patients able to resume desk work during this time. By weeks 5 to 6, you can begin to lift exercise and activity restrictions, and most patients can return to their full work schedules if their surgeon gives the green light. Having a support system at home during the initial days after surgery is also very important for your safety and comfort. Ultimately, the decision on when to return to work should be based on your individual healing progress and your surgeon's evaluation. In summary, while many patients can return to light work within 2 to 4 weeks after abdominoplasty, the exact timing will depend on your specific recovery and the demands of your job. Always follow your plastic surgeon's post-operative instructions closely and attend all follow-up appointments to ensure a safe and effective healing process.